Let us have a quick look in what is happening with the WBA rollout in South Africa, looking at our context and also looking at historically what has been happening and where we are with this program at the moment. So I've got an overview of the timeline here, and actually already I think from as early as 2019, there has been a lot of meetings and discussions around the need to relook at our postgraduate education. And then in March of 2022 was sort of the official decision making between SACOMD, that's the South African Committee of Medical Deans, and the Colleges of Medicine that we want to bring WBA into postgraduate training. And it's very important that this is carried as a joint project between the universities and the college, because they are all responsible for postgraduate education, medical education in South Africa. So the first step then was a situational analysis that was actually done in October of 2022 across 44 programs. I'll have a brief word about that analysis, which we've actually just published, to start getting us an idea of where we were at that point of time. And then since March of 2023, there was starting to be workshops held at the different faculties on EPA 101 as well as WBA 101. Some of you might have been involved in those, and just starting to prime people in terms of sensitize them to the language and the thoughts of this. In September of 2023, a national study was officially launched to start implementing, and the way we are doing it as academics is we are researching while we are implementing. So it's a little bit of being in the sandbox and going, okay, well, let's try some different things and let's see what works and what doesn't work. So that project is called the OpWorks project, and we actually have ethics approval at all our different sites to be able to do this piloting process. Last year, in June of 2024, we actually had a report back on what's happening with the different universities in terms of the OpWorks program. And now in 2025, we're really moving on to the next phase. And I'll talk a little bit about that, which is what this training is a part of, is actually starting to put together training for our clinical supervisors and starting to put together manuals and actual implementation packages for people who have been in the sandbox and want to start really implementing WBA in their disciplines. So this national committee that's been established by the colleges and SACOMD has actually created 4 work streams, and you will come across these different work streams in different contexts. So the WB implementation stream, which is the one that has asked for this training to be created, is the OpWorks stream, meaning the operationalization of work-based place assessment, and Prof. Taslim Ras is overseeing that process. That will include the national study that I've mentioned, the setting up of clinical competency committees, and a lot of the practical aspects of WBA rollout. Then there's a second stream looking specifically at the development of these EPAs, headed by Professor Maya Adams. And there's different colleges in process, and there's already been some publications in terms of where different colleges are at with the development of their EPAs. That process now is starting to take, the more colleges that are developing EPAs, the more other colleges are getting excited to get involved. We also have a tech stream that's specifically going to look at that work-based online tool on where you capture information, but also to think about what e-portfolios might be possible. And the dream is eventually to have one standard e-portfolio through the colleges that can then be part funded through all the universities, rather having lots of different versions. But at the moment, everybody's still in the sandbox experimenting, and it'll be quite a few years before we'll have one standardized e-portfolio available. And then there's a committee that's specifically looking at MMed regulations. So there's actually quite a lot of variety what's happening between different universities. There's also been some hiccups at some of the different universities with the MMeds, and Dini Mawela and Alan Horn is looking into understanding that landscape better and be able to also understand what's going to be the relationship between the WBA part of the program and the MMeds. So this is just a couple of slides on the situational analysis that happened in May 2022. It was a national forum with some ethics approval, and then a massive online survey that was rolled out. I'm not going to go through the survey in details, but if you're interested to go and read some more about that, it was published in the Journal of the Colleges of Medicine in last year, November. And you can see it's got representations of all the different universities. So the only thing I thought that might be useful to extract from that is some of the barriers and enablers that was identified from the different, if we're going to do this, can we do this? And one of the big concerns has been the data capturing of all these work-by-place assessments and how we're going to access these portfolios. An issue is always Wi-Fi access. We need portfolios that can work in rural and remote areas. There's also a bit of a concern about all these WBAs, because WBAs in themselves, you cannot get away from some bias and subjective nature of assessment. And that's hopefully going to be mitigated by the number of assessments, but that might also be a challenge in smaller places. Very much highlighted repeatedly is a lack of training for clinical supervisors on WBA and giving feedback, and then concerns about lack of resources, capacity, infrastructure. Standardization came up as a worry that there will be little different things happening, and we've spoken earlier about this difference between standardization and benchmarking. But we do need to look at how the WBA is going to be implemented at different sites. There was also enablers noted. So we actually have a wonderfully strong regulatory environment between the college, the HPCSAs, and the universities, with some very strong relationships already and very strong, powerful regulations that shows how those committees work together, and we can build on that to incorporate the WBA. So although technology is a worry, we're also in a new world. Almost all registrars have got smartphones, and everybody's got Wi-Fi access at some point in the day. And actually, that actually makes it also easier now to step into that space. And I think a lot of people recognize that actually we're already doing workplace-based assessments, and we're giving feedback. There's already lots of different ways in how we're interacting with our registrars, and this is going to be a better way of actually making it possible to put WBA on top of that. We also have actually very good and experienced consultants already in our facilities providing this supervision and feedback. And the registrars have been very keen on this program. They like having a very clear map of what has to happen, and they're desperate for feedback on their performance. So interestingly, although standardization came out as a concern, it's also seen as actually a way of promoting it by having one set of EPAs that we are all working towards, and that actually helps us standardize the standards of what happens when registrars leave the other side. And very, very much directly sticking to here is that this actually also makes it possible for us. We've always actually talked about the need to have a supervisor training, and this is just motivating us to get that up and off the ground. I'm going to have a few slides on the WBA OpWorks project. So as I've mentioned, we are academics, and when we are academics and we do anything, we'd like to study it while we're doing it. So there's actually a specific study. It's a national multi-center study that's going to be describing WBA practices across the various disciplines and training institutes in South Africa. And we are actually going to look at this while we are implementing to see what the impact of implementation of WBA is. So it's got lots of objectives over different phases, and we are particularly here in number 2. So number 1 happened during that situational study. At the moment, we are really looking at the experiences, perceptions, and concerns of those early pilot sites that have started playing with WBA. And you'll see there's various phases as WBA gets rolled out where we're going to observe how we are doing. So this is the actual methodology, that it's a mixed method longitudinal study. We have identified across the 10 institutions, NMU is involved now as well. Each university has been asked to identify at least 3 pilot sites. So for example, at WUSU, we would say, well, family medicine as a discipline, anesthetics as a discipline, and ops and gynae were keen because we were already doing things in our respective colleges. What's happened with us locally, for example, is as W has been rolled up, there's other colleges or other disciplines that's saying, hold on, we've also started to do WBA and we need some assistance. So we are adding sites as people are getting excited, although our phase 1 qualitative study is mainly focused on our 3 initial sites. So what happened last year is we actually did a qualitative study using focus groups and training interventions from those first 3 disciplines to see the experiences and perceptions of both the registrars as the supervisors. And that, I think, will probably be published this year. And so when we're now looking at where we are at now in South Africa, the EPAs are being written by all the colleges, but the focus of 2025 is actually training up our clinical supervisors. So WBA is going to be operationalized by clinical supervisors who's going to be providing WBA and, very importantly, providing feedback. So the colleges and SACOMD with the WBA OpWorks stream has identified the fact that we need to train at all 9 of the universities. So we have actually asked the South African Academy of Family Physicians to assist us with creating the content for the course, as they have a very successful 5-day training on the training of clinical trainers that they've been running for many, many years for family physicians. So we were looking at something that can be appropriately implemented across all the disciplines, but also can easily be incorporated into busy schedules within the universities. So we've created a short course that is worth 24. Involves 24 hours of studying, which is 20 general CPD points and 4 ethical points, and 12 hours of that will be completed online, asynchronous at one's own time, and 12 hours will be this face-to-face contact, which can either be 2 days or 4 half days, depending on what works for the university. There's funding to provide this training to 540 supervisors this year. So the idea is that each of the 9 universities can be supported to provide 3 trainings at each university with 20 participants at each training, and we will be involving as many disciplines as possible. So this training that you're doing at the moment is very much embedded within this larger rollout of WBA in South Africa.